If someone starts and they go, hey, it's Dr. Levi, isn't it? Or how do I say that?
Good afternoon for me. Good morning for you, Dr. Levi. I'm super excited to have you on all the way from Australia. So welcome to the podcast.
Hey, Brittany. Hi from Australia at, I don't know, 6, 7, 8 a.m. or something silly.
Crazy. Always working. I love it. And the energy. Man, I wish I could match your energy at 6 o'clock in the morning.
The great time of day. And if you're seeing kids all day long, it's just joyous, man. And then you see them thrive. So I'm just like working in a sandbox at the kindergarten all day long. It's just fun.
I love it.
Tell
That's
me, tell me,
fantastic.
Brittany, how can I help you on this morning? What can I
Yeah.
share with you? What are we going to do? What's the story here today, Brittany?
Yeah. Well, first, I want you to share a little bit about your story, your journey, how you got into dentistry, how dentistry got changed into airway dentistry, how working with adults turned into working with children. I want to hear everything about you.
Right. Well, my mother is 96 years old at the moment.
Oh,
She's in
God
good
bless.
nick. She's great. And about 3 or 4 years ago, she edited my bio because she writes a lot. And she said, "Oh my God, darling, you've had an awful childhood and adulthood." So when I was young, I went to bed till 13. I call that breathing. I almost died of asthma. I call that breathing. I had terrible sore jaws at 18. I call that breathing. At 22 or something, I got my dentist degree. Mum and dad were proud of me. I don't do any dentistry at all anymore. I just do kids' growth and development airway. At 40, though, I weighed nothing, ran 10 Ks on the 10 miles on the beach every morning at 5 o'clock. They said, Dr. Mark, you've got the worst sleep apnea in all of Australia. Look, here's a CPAP machine, but you're going to die slowly, so just go away. So I jumped on a plane and went to the US and fell into, dental, adult breathing, sleep apnea. And then, I don't know, 8 years ago, that morphed into kids and fell into, I've done about 20 years in the US, 25 years. I'm over there next week. Or the week after. So I love all my heroes are in the US, all my heroes. So I'm a bit alone over here on the island of Australia. But we're working really hard to get more of me in Australia. But all my heroes in America, and that's how I got in the kids. And the kids stuff, I went to a course in the US, as I do, and I was really there for adults, of course. And then the kids stuff popped up, percolated. And
Hmm.
man, oh man, the more I hung out with kids, the more I went, Mark, you got to go to work, man. You can't sit on you can't leave it. You got to go to work for the kids.
Hmm.
So, look, that's my story. These days I have people fly in to see me from an hour away. They drive 8 hours to see me because there's no one around that does what we do. Parents are desperate for help for their children so they have less symptoms. And really, I suppose once a week, once a month, we get a phone call from America or a phone call from Europe that says, "Hey, do you know anybody near my house that can help me?"
Hmm.
Brittany, that's my passionate story. So I've got skin in the game. I'm fixing my grandkids now that are 2 and 3 and 4. I mean, I got
Nice.
skin in the game. Okay. Can I go home now? Is that it? Did I
Not quite
pass?
yet. You're not done yet. Not done yet. So I want to know now. I know you've been doing this for some time now, so people already know what you're doing when you're practice. But I guess like in the beginning, when you made that switch from, more traditional dentistry to airway dentistry, how did you approach with families, explaining the importance of early
Ah,
intervention, like
the
especially
question of
when they've
question
never
of
heard it before.
how to go from a dental office to a breathing office.
Mm-hmm.
Well,
Mm-hmm.
you won't like my answer at all. What you do is you go into the office on Monday and you go, you know what? No more dentistry. Just lock the front door. Just change the sign on the front door and say, go away if you've got teeth, and put a new sign on the front door that says, we're only treating children uh, 3.5 to 15 years old, preferably 3 and 4 till 12, that have symptoms that sound like a growth and development sleep disordered breathing issue. And ideally, that's what we did. And so we have people that come from that don't know. We have people that sit in my office and go, who are you and what do you do? And how come your messaging resonates with me? I've come to listen to you. So the answer is, I don't know how to morph. I tell you what I do know, Brittany, and I better be helpful. I believe that every single patient that walks in the front door of a dental office should be screened. And that screening should take 1 minute, 3 minutes, 2.5 minutes, 6 minutes. There's about 100 different ways to do it. And if you've been around a little bit, you'll go, yep, I like that I like that form, that technique, and those questions. Doesn't matter if the dentist does it, the hygienist does it, or the receptionist does it, to be honest. There's so many ways to screen in an office to say, you know what? We didn't know 11 years ago, or was it 18 years ago, the brain was busy at night. The brain at night, it's got its own irrigation system. It's called glyphatics. It lights up at night like the 4th of July. And we didn't know that. And so we didn't know sleep was a thing. And so this is a new area of dental sub specialization. And so I'd like to screen you and just see how your kid's doing, because I've been some amazing courses and I've met some amazing heroes around the world. And I've read some amazing books and information, and really, I'd like to screen you. And if every single under 18-year-old was screened in a dental office, well, we might change the world one step at a time, Brittany.
Absolutely. Now, what are some of the more common behavioral or developmental issues you see in children that might be linked to sleep disordered breathing? And then on the opposite end, what are some of the more uncommon or ones that aren't as relevant in people's minds that might be linked to sleep disordered breathing?
I've got about 20 symptoms, Brittany, from the sleep questions like restless, grinding, loud breathing, mouth open. There's the behavioral questions, the anxiety questions. There's the venous pooling under the eyes question, which goes with sleep, the how are they in the morning questions. So I've got my own, well, I've just given you 20 and I haven't even looked at a piece of paper. I then can look at the child, look at because I always put the child in a consultation room with no dental chair and carpet to do the initial consultation. I don't like a dental chair, especially first appointment. And I always have the child on my left. So what happens is I watch the child, watch the mouth open, watch the behavior, interact. Mum's in front of me. And you can glean a lot looking at a child's face structure and what they're doing. And of course, you can always just look at the child and go, show me your teeth, and look at the crowdedness, the cross bites, the high maxillas, the, things like that, the large tongues, the tonsils and adenoids. You can do all that without touching a child, really.
Now,
And
what are some of the things that you would say before you're even looking in their mouth? Like so when they're sitting in that chair to the left of you, what are the things that you might be looking at, just for some of our listeners that maybe aren't familiar with like airway evaluations?
you've got to have your list of you've got to, if you're a professional, well, if you're a dentist or a dental person or a medical person, or even if you're a mum and dad, you've got to have enough. You've got to have a list of all these. You've got to have a list. I say backhandedly, you can have a look at my website, and I think there's, I don't know, I think there's 25 questions. There's a list of 25 on my website, on Dr. Levi's website. The there's a whole list of things you should be looking for and looking at. And a dental professional or medical professional should be developing that list for themselves, whether they're an ENT, whether they're an orthodontist, whether they're, it doesn't matter what health, the allied health are wonderful, the OMTs, the chiro osteos, the speeches. It's quite interesting in Australia, in where I live, that the speeches are not taught about the tongue at all in their curriculum. And so I suppose I'm spruiking lots of homework, do some reading, go to some conferences, but you can have a look at my website and find out the first 10 questions. And the more you do your homework, the more questions you'll ask people, the more screening you'll look at people. I think on my website there's a medical dental screening tool for the doctors to download, I think.
Okay.
So I just see patients. I don't know what they've done with my computer. So look, there's lots we can do for the kids, but you know what happens, Brittany? They ring up and they go, "Can we see you? Because I'm not sure, but maybe you can help my kid, maybe." And sometimes even on a Zoom, you can pick up what's wrong or enough wrong to say, you know what, I want to do some full diagnostic metric analysis. And whether, if I told someone they had spleen cancer, they'd go, "Can you do some tests, please?" So if we see a child that at a consultation that we think, "I don't think that's great," we need to do all those tests that you should have been trained to do to get a really a thorough evaluation of what's good, what's bad, what worries you. Has that maxilla grown enough? Has that mandible grown enough? And I'll give you one pearl of wisdom that I love to say, Brittany. One pearl of, I say to people that the maxilla is the chairman of, the bank, the chairman of America, the president of America. I don't know. I say the top jaw is the president, okay? Because the top jaw almost defines how much the lower jaw, nose, sinus, tongue space, teeth space, tonsil and adenoid space, airway space. There's one or two more, I've gone blank. And so that top jaw defines the whole craniosacral respiratory complex, the whole thing. And so just that stupid little old maxilla. And so when you explain that to a parent, they go, "Oh, so you're not just a dumb old dentist shoving things in mouths. You actually can affect as a domino the whole freaking thing."
Right.
And I'll give you one more passionate pearl of wisdom. So kids, adults, kids, adults, kids, adults. So I started with adults for 20 years. I did adults. I don't know if I missed that bit, but I did adults for about 20 years. And they're frustrating to treat because they are really difficult, okay? I gave a lecture in Singapore not long ago and said, "Hey guys, if we all treated the kids, then you guys could retrain because you're all doing adults and we wouldn't need any adult doctors. And we could probably minimize some of the ENT, orthodontic, braces, pull teeth out, occupational therapy, not OMT, maybe chiro osteo, all the speechy, all the problems from 4 to 18, we could minimize, we could lower, we could shrink if we got in early." And so my problem at the moment is that I've seen too many adults in my career and I've got a crystal ball. And sometimes I see the mum, I see the kid. I see the mum and I see the kid and I go, "This ain't going well." And then the mum says what her problems are and the dad says what his problems are. And they open their mouth 5 seconds. And every now and again you go, whoa, this isn't going to end happily.
Mhm.
So there's a good encouragement to go to an adult. Go to the adult courses, go to the kids courses, go to the
Right.
adult courses, go to the kids courses, because they're linked. All right. Sorry, I got on a tangent and I got a bit passionate there, Brittany. I apologize.
I love it. No, don't ever apologize for that. What about, I'm curious because, here we struggle often to get the medical community on board with everything that, airway dentists do or, things I'm looking at as a myofunctional therapist. How is it for you? Do you feel it's been easy to find that team, that ENT? I feel like ENTs are usually the most difficult to track down. How's that experience been for you in Australia?
I've been in 25 years. I've been in with a dental degree. I've been, breathing, sleep, adults, kids. 25 years, I think I've been since I was 40.
Mm-hmm.
And I'm old. Look, it's always hard, Brittany.
Mm-hmm.
If you're a medical dental person listening, it's really hard to get a team together. It's really
Mm-hmm.
hard to get a team together you trust. It's really hard to get a team together where you can pick up the phone and go, George, fix it. See
Mm-hmm.
you later. It's Mark. Bye. It's really
Mhm,
hard, but it's worth the effort.
mhm,
And don't think it's just going that's not going to happen overnight. But I want to ask you a question, Brittany.
mhm.
Here's a question for you. Put your wrists up. No watch. Okay. Put your hands down. Put your hands down. Do you own one of those watches that talks to you?
An Apple Watch I have, yeah.
All right. You got a watch that talks to you. Okay. Do you have one of those cars with that electricity thing?
No, I do not.
Okay. Were they normal and common 10 years ago?
No, they were not.
No. So here's HOPE, because I love selling HOPE to all the parents, the desperate parents. I love selling HOPE. I don't promise HOPE, but I like
Mhm.
selling it. I tell them, I say, I'd like to sell you HOPE, and they go, hope. Oh, okay. So, so what we do with these kids will be normal, I think, like the watch and the car and the mobile phone in
Mhm,
10 years' time,
mhm,
because we didn't know what we didn't know
mhm.
20 years ago. We sure didn't know anything when we were young dentists 30, 40 years ago,
Right.
but we're learning stuff in the last 10 years, 15 years that's really mind blowing. And
Mhm,
parents are reading it, parents are
mhm,
seeing it. There's great books out there. Everybody's website that I've looked at, they've all got a library of books for mums and dads to read. I've got
mhm,
a library of books for mums and dads to read. And so the information's getting out there. We're going to be treating these kids younger and younger because we need to get them to breathe.
mhm. Absolutely.
And
What about
we need the Britneys of the world because we need the allied health.
Mhm,
We desperately need the Britneys. And so if you're listening and you're wondering, what does Brittany do? And you're wondering, I'm a speechy or I'm an OT or I'm a physio or a chiropractor, a lot of a lot of people I interact with, they
mhm,
go, "Hey Mark, how do I plug into that and upgrade my skills to do what Brittany does? Can I do Brittany's course? Who in Australia does that stuff? Who can
mhm,
does it face to? I want to upgrade my skills so I'm more useful in the
mhm.
allied health space."
Absolutely. I'm a big believer in, I don't think that everybody, if they don't want to become a myofunctional therapist, they don't have to, but taking the course to be able to recognize the symptoms and make a referral makes a world of difference. Every single person, to your point, especially in the dental community, but any allied health professional should know how to screen for airway because the amount of lives, like you said earlier, that we would change is infinite. What about, can you share, I don't know if a certain case jumps to your brain when I'm going to ask you this, but a memorable case that you can think back on that you've made, just a significant improvement in their health, their overall quality of life? Are
I
there any
got two.
families
I
coming?
got
Okay.
two.
Yeah, let's hear them.
One's Monday a week ago.
Okay.
So it's Monday a week ago, and the dad drives 7 hours to see me
Mm-hmm.
with the 5 and a quarter-year-old. And I'd finished him. I was just checking him. I think I was checking him. I think I'd finished him. And so I said, "Hey, Dad, how's the kid? How's he doing? I've got my piece of paper in front of me, and it's
Mm-hmm.
got about 100 symptoms on my piece of paper, okay, with his name on it." And Dad goes, "Well, he's just perfect. I mean, he's great. There's nothing wrong with my kid anymore. I've just driven 7 hours to see you, Dr. Marks, because you told me it was a 3 month it was a 3 month post, just double checking what's going on."
Yeah.
He drove 7 hours just for a 5 minute double check. Let's make sure everything's doing okay, tracking well.
Mhm.
Maybe my OMT also saw the child that day.
Okay.
So and that child, gorgeous little 5.5-year-old, that was a
Oh.
train wreck a year ago. So that's my number one favorite. And my other favorite is oh my God, there was a child yesterday that hugged me in front of the mother.
Oh.
Oh my God,
Oh.
caught me off guard. Caught me off guard. I'm a bit uncomfortable with all these kids hugging. Where's mum? Where's mum? Someone watch. I need a witness. Um, no, normally the mum's always there. Mum's always
Yeah.
there. But it's pretty humbling to have a
Mhm.
child that before they say hello, they give you a hug. And
Mhm.
then, but the second one was, there's a family that live it'd be an hour plane ride. So I saw the 6 and 8-year-old, or 6 and 9-year-old, and one of the kids stopped snoring in a couple of weeks.
Oh, that's incredible.
The 8.5-year-old, for the first time in his whole life, stopped bedwetting for about a week. Well, was dry for 8 nights. But the clangor was, now I see that whole town, it's a town in the middle of nowhere. It's like the Cupterville. I see the whole town.
Oh my
They all
goodness.
they all drive they all drive 9 hours to see me, and
That's
so
cool.
because every mother goes, "I want what that 6-year-old's got. Whatever he's smoking, whatever he's eating, I want that." And so, but the real clangor of that was the mum rings me up. I'll never forget. And she said, it was about 3 months ago, and she said, hey, Dr. Mark, yeah, my kid, the 8-year-old's doing better at school." And I went, "There's nothing wrong with your kid on my paperwork cognitively. There's no cognitive flag. What do you want about?" And she said, "I know." She said, "I know. But guess what? He's doing so well, the teacher wants to know what I'm feeding him at home because he's improved that much at school." Okay. So, so the answer to your question is, you have good days, you have bad days, you have people that give you a hard time. But
Mhm.
at the end of the day, if you see, I don't know, I've probably done about 2,000 kids now. If you see enough kids and you treat enough kids, and as someone said on a Zoom meeting the other day, the older they get after 3 or 4, or 2 or 3 or 4, the more complex the case gets. If you do enough kids, you will see enough joyous, oh my God moments where you
Mhm.
go, I think I saved a kid. I think that kid's not going to be Mark Levi at 40. I think he's not going to be Mark Levi at 13. I think
Mhm.
that kid's not going to be Mark Levi. Yay, team. I've done some good. And
Mhm.
so, yeah, sorry, I'm on a roll. You asked me a passionate question. If you do
Yeah.
enough kids, you'll see change.
Mhm. Mhm. What are some steps that parents can take to become more aware of airway health and potential sleep issues in their children at home?
Um, well, uh, the answer is information. So I have mums that follow my Instagram page. I have mums that follow a lot of the American online. You know, I have mums that follow Brittany. I have mums that go, oh, I've been following a couple of the American guys and girls. And so information like Brittany, information like Levi, you know, a lot of mums follow that stuff and they go, this is, so what they're actually doing is they're building their knowledge base. They're getting information. And then they occasionally you'll get someone who's a reader and they'll read a book or two. Man, oh man, the mums then go, you know what? This is I'm gonna go and find that sort of clinical doctor person. And you know, occasionally we'll get a referral from America because the American noise is so wonderful. And they'll go, I found lots of these sort of people in America, but I can't find them in Germany or Australia or you know so the answer is mums and dads are online, and we didn't have online 20, 30 years ago. So we're very blessed to have the opportunity for mums to follow Brittany, to follow all the other people in the world that are giving information out there.
Absolutely. What advice would you give to not necessarily newer dental professionals, but any dental professionals that maybe are considering integrating more, airway health dentistry techniques, whatever it is, expansion, tongue ties, myo, anything into their practice? What advice would you give to them as just starting out with it? Aside from putting a note on the door that says no more teeth.
Look, I've hung out in America with a couple of societies, a couple of crowds, a couple of teams, I'm in America at I haven't done this before, the American Sleep Breathing Academy. I'm very excited to be at that because one of my pals in Alaska, a big shout out to you, Jerry, said, I saw Jerry in Singapore and he said, hey, Mark, you got to come over to Houston and it's a great conference. And I looked it up. And so continue education and going to enough courses that you work out what flavor you like. Because it's like, I don't know, curry or Indian food or something. I mean, what flavor of Indian food do you want? How much curry do you want? And so it's a flavor thing. And you've got to get around. And it's really, I was going to say sad, but you've got to do your homework. You've got to get around to the different, but you go to a big 2-day conference, preferably turn up because you'll get 10 times more out of it, especially in the hallway. And you'll work out where, why, what. It ain't no one-step process. It ain't no one-step process. And if you can find a mentor, that's even better. But that's the really, you're asking hard questions, Brittany. It's you're asking hard questions and you're probably interviewing people that have done this for 20 years and they haven't done it for a week. And you're going to make some mistakes when you walk the path. You've got to, not mistakes, you've got to learn. It's not just an easy ride.
Right.
But you do one child and, well, I'll tell you a joke. It's not funny. There, well, that's a good joke to tell you. So I've got a lady who's in charge. Oh, I fixed her kid. And now she worked, I gave her, she asked me for a job. And I said, I don't have a job for you. Go away. And then a week later, I rang her up and said, I fixed your kid. Yeah. You want a job? Yeah. Can I give you one? So I gave her a job. This is 6 years ago, I think.
Oh my God.
She's in charge of, I don't know what she does in my office. Who knows? Anyway, she doesn't even work in my office. She works remotely from home, about an hour away by car. And so here's the message though. Our goal was to see, I think it was 2 children a week in the early days. And so when we got 2 children a week, we went, whoop, whoop. We saw 2 kids in 1 week. And then, we look back yearly because she's still with me. And she's in charge of our messaging, I think. And I don't know. I just do what I'm told in my office. I'm just a dumb old doctor. I do what I'm told. Uh, you know, now we're just snowed under and booked out. And I started, and I'm old, and I started seeing 2 kids a week. And that grew like now I don't know if you can see this, but it didn't grow like that. It didn't grow like that. It didn't grow like that. It grew like one of those NASA space things. It went
Yep.
vertical and it just exploded.
Mm-hmm.
And so I think that's good to hear. I think it's good to hear that if you do 1, you'll then do 3. And when you do 3, you'll do 6. And when you do 6, and then you'll go, I get this now. I know what to do. And you know, you got to have someone you can ring and
Of
ask
course.
questions. So
Of
does that
course.
help, Brittany?
Yeah, absolutely. And I think, like you said, having a mentor, having and understanding the importance of like that multidisciplinary team and everything you said. I mean, I totally 100% agree with. Is there anything else that you'd like to leave the listeners with before we wrap up for the day?
How
Well, your
can
day's
you
just starting. My
how
day's
can you how can you help if someone's listening and
uh-huh.
they're allied health? I'm interested to hear what Brittany has, what message Brittany's got for allied health that, you know, they're good in their allied health field. Um, their children are seeing Dr. Mark.
Mm-hmm.
You know, that's the irony, really. I'm seeing all these kids and the mums are allied health. And so
Mm-hmm.
the mums are asking really, really, really intelligent questions.
Mm-hmm.
So what would you say to those mums that I'm seeing their kids?
Mm-hmm.
How can we help? How can we help allied health more
Mm-hmm.
to help the team? How can we integrate? How can we get more allied health? Because we've talked about doctors learning, we've talked about dentists learning, but we haven't really touched on how to get allied health to learn more. Is there an idea? Is there anything there?
Yeah, I mean, I think most importantly is what you mentioned before, continuing your education, staying open and curious and accepting that we never know everything first and foremost. Second, I think that, and I'm sure you would agree with this, everybody that's in this field is so gracious with their time. Like you are taking, you're 6 o'clock in the morning and you're taking an hour of your time to come and chat with me and you're not getting paid for it, right? It's not technically doing anything for you, but you're very gracious with it. And there's so many allied health professionals in this field, doctors, sleep doctors, airway dentists, everybody that is doing that. And there's so much free educational content that is out there. You know, Dr. Zaghi has his lectures on YouTube, Airway Health Solutions hosting their town halls, podcasts like this. Like you don't have to start out. I mean, eventually you're going to, once you get into it, dive into that rabbit hole and want to take all the courses and attend all the conferences, but you don't have to in the beginning. Just let that curiosity spark your interest. Start listening to podcasts like this, looking up things on YouTube. To your point, social media, there's so much free education out there. And then, like you said, like integrating a simple screener. Like when I talk to a group of hygienists, you know, and I get it. I was a practicing hygienist before I did this. And I don't think people that aren't in the dental field realize how much a hygienist is responsible for doing in the short amount of time that we're with a patient. And when you start then saying, well, okay, now we're going to do an airway screener, it's like, whoa, all you guys do are constantly add on things and jobs that we have to do. But as you mentioned in the beginning of the episode, it could take a minute. Like, especially hygienists, you are in that area all day, every day, 45 minutes to an hour with a patient. You're already seeing the things you need to see in an airway screener. You just need to document them and know what to do with them. So that was again, I'm like you, I go on tangents, but I think I answered your question.
You know, if you're a hygienist or an allied health, if a child opens their mouth and the teeth don't fit,
Mm,
I mean, that's like 101. I got a funny feeling that bone's not grown enough.
right.
And if you go and study Professor Robert Coroncini's work on anthropology,
Mm-hmm.
and I love him. This you know, he gets a Nobel Peace Prize from me. I think he's
Yep.
Mother Teresa. And if you look at a tongue, I was doing adults for a long. I might finish on this because I think it's
Yeah.
I think it's profound. Okay, profound. That I didn't realize how dumb I was. I used to go to these courses for adults, and I was missing. I never went to. I don't know why. I never went to a course where they spent 1 hour teaching the really, 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 really 101 dumb stuff. Okay, and so I look back now and think. Or maybe I missed it, okay? Or you don't know, it passes you by. Maybe the conference was all for not the advanced stuff, but they figure you got to know something.
Mm-hmm.
I think that if you look in the mouth of an adult, especially an adult, or a child, but you see the teeth don't fit, that is a problem. But when you see a tongue that is big, fat, and ugly with dents all around it, that is a big, fat, huge flag
Mm-hmm.
that tongue ain't happy in that mouth.
Mm-hmm.
And so um, no one ever told me to go look at well, 10 years ago, I couldn't spell tongue. And I did a survey about 5 years ago to my dental buddies. And I said, hey, what's the tongue for? And they went, that's the thing that gets caught when I drill around the back molars.
Mm-hmm.
And so I think the tongue is I'm talking to Brittany, the OMT. Sorry, I apologize. I think the tongue is an undersold, la 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 thing
Mm-hmm.
that none of us really fully. I saw an ENT yesterday, my ENT, my buddy, my guy I trust, and he was telling me, "Hey, Mark, by the way, I've started referring to your OMT, your myologist." I was
Oh,
very
that's fabulous.
I was very, very chuffed. I was chuffed because you've got an ENT that's going, I might add a myologist to my circle of influence. Okay.
Mm-hmm.
So if you look at a tongue, if nothing else, you're
Mm-hmm.
a hygienist, you're a dentist, you're a pediatric surgeon, you're a brain surgeon, you're the Pope. I don't care. You get them to open their mouth. If the teeth aren't fitting, I think there's a problem. And if that tongue's big and it's sort of looks like it's big in there and it sort of looks like it's got teeth marks all around the edges, maybe there's a problem. Maybe there's a problem. And that's really, really, really low hanging fruit.
Yeah.
And that's there's some low hanging fruit. But Brittany, I hope I've been somewhat helpful.
This was fantastic. Thank you again for taking the time to come on and chat with me.
Any time, Brittany. I look forward to seeing you again in the US shortly, whenever we overlap in between you working, mothering, familying, lecturing, and everything else you do. And a big, big shout out to you, Brittany, because you are doing a lot to change the world. And so a big shout out that Brittany's one of our unsung educating heroes in between mothering and babying and husbanding and working and running the office. And she's doing educating as well. And she's messaging out there to go, guys, sure, I do some teaching and I get paid sometimes for that, but I'm also doing some educating on the side and I'm trying to help people on the side and I'm trying to get out there and send a message. And there's lots, as you said, there's a lot in the tribe. I called it, tribe that tries to get out there in their own little field and go, hey, we can help. Hey, here's some messaging. Keep digging. You're on the right path. This is new. It needs to be done. We need to get these kids to breathe. We need to get these kids to grow and breathe, grow and breathe, grow and breathe. And if you tell me 10 years ago, I'm talking to Brittany, the tongue lady. If you tell me 10 years ago, I was going to talk to Brittany, the tongue lady, all about the tongue and this thing called myology, I would have laughed. So, and the phone talks to you, the car talks to you, and the 5-year-olds have mobile phones. The world is changing very fast, guys. Save these kids, because someone has to run the nursing home, Brittany. When I get there, someone's going to run the nursing home. We need these kids thriving. Thanks, Brittany.
Absolutely.